Hello, I am Dr. RAYSTRAND. I've been a private family physician now for over 40 years. During the past 20 years, I have focused my medical practice in preventive and nutritional medicine. I have written several books, many of which have been translated into Chinese. However, I am very excited to announce the release of my newest book in Chinese, which is called What Your Doctor Doesn't Know About Heart Disease and Strokes May Be Killing You. The medical and scientific research contained in this book is not only cutting edge, but also life-changing. It presents the true cause of cardiovascular disease, or what we commonly refer to as hardening of the arteries. Not only don't most doctors know about this groundbreaking research, but they also do not know the best approach to help you and your loved ones possibly avoid or at least decrease your risk of having a heart attack or stroke. Cardiovascular disease has increased dramatically in China during the past 20 to 30 years. In fact, deaths due to cardiovascular disease, like heart attacks and strokes, have increased from 24% to now causing over 45% of all the deaths in China. Many people refer to this as hardening of the arteries because over time, calcium actually builds up in your arteries and causes them to become stiff and narrowed. Therefore, almost 1 in every 2 people in China will die because of this aging process. Most all of the research and primary treatment for vascular disease throughout the world, and including China, has focused on lowering your cholesterol levels with statin drugs. However, even with this aggressive treatment to lower cholesterol levels, cardiovascular disease, or hardening of the arteries, has increased dramatically in China and is now the #1 cause of death in China and throughout the entire world. The treatment of heart disease with this aggressive lowering of cholesterol has proven to be only marginally beneficial, and when you look at China, deaths from vascular disease have almost doubled in just the past 20 to 30 years. Could it be that we have been treating the wrong thing when it comes to heart disease and strokes? Maybe we should have been looking at the calcium buildup in our arteries instead of cholesterol. Instead of looking at cholesterol as the underlying problem, researchers are now looking at why there is a slow buildup of calcium within our arteries. After all, this buildup of calcium is what is causing our arteries to become hardened and narrowed. Well, in 1988, Dr. Olavi Kahander, a microbiologist from Finland, made an amazing discovery. In the cell cultures that he was growing in his lab, he was able to identify a very small bacteria that was actually contaminating and ruining his cell cultures. This bacteria was so small that it could only be seen with the use of an electron microscope. He called these new bacteria nanobacteria because of their very small size. In fact, it is the smallest self-replicating living organism that has ever been discovered. They are also very slow-growing bacteria. In fact, in order to grow nanobacteria in cell culture, it takes a minimum of 30 days, rather than the typical day or 2 for normal bacteria. Because of its small size and slow growth, no one had ever discovered their existence before. Dr. Kahander, under an electron microscope, was also able to identify the presence of these nanobacteria inside a calcium shell within every arterial plaque in our arteries in those individuals who had cardiovascular disease or hardening of the arteries. The medical literature has documented that heart disease is not a disease of too much cholesterol in our bloodstream, but instead was a result of inflammation of our arteries. However, no one really knew the exact cause of this inflammation until now. Dr. Kahander has been able to show in his clinical research that nanobacteria actually invade and infect the lining of the wall of your arteries. This sets off an inflammatory response by our immune system. You see, our immune system is able to recognize these nanobacteria as a pathogen and begins to attack this infection in the lining of our arteries and tries to destroy it. Nanobacteria are found everywhere and can easily gain entry into our bodies through our food and water supply. They are so small that even normal sterilization techniques are not able to filter out or destroy these nanobacteria. Once inside our body, they can actually gain entry into the lining or walls of our arteries, especially if there's a disruption of any kind to this fine one-cell lining of our artery called the endothelium. These nanobacteria begin to replicate and cause an infection within the wall of our arteries. Now, our immune system recognizes this infection like it does all infections in our body and seeks to attack and destroy this foreign invader. This causes a significant inflammatory response. However, the nanobacteria possesses the ability to create a slimy, soft biofilm around itself in an attempt to fight off this attack from our immune system. This creates the soft plaque that is the hallmark sign of early vascular disease. Dr. Kahander has also been able to identify antibodies against these nanobacteria that were created by our immune system in 100% of the individuals who suffer from cardiovascular disease. This gives even further evidence that cardiovascular disease is an infectious disease and not a disease of cholesterol. The nanobacteria also have a unique ability to attract calcium from the bloodstream and surrounding tissue and actually form a calcified shell or igloo to surround itself. This calcified shell now better protects them from our immune system, and the only option our immune system now has is to actually wall this infection off, which now is called a hard plaque. Dr. Kahander, along with researchers from Mayo Clinic, Cleveland Clinic, University of Texas, and several medical centers in China, have now been able to identify these nanobacteria in the walls of our arteries. Nanobacteria have actually been found in 100% of the individuals who suffer from this hardening of the arteries, or what we refer to as cardiovascular disease. Researchers agree that vascular disease and the eventual hardening of our arteries begins in childhood and becomes significant in your teenage years. Over several decades, this very slow infectious process hardens our arteries, causing them to become stiff and less pliable, while at the same time beginning to narrow those arteries. Therefore, this infectious process eventually can lead to a heart attack or stroke. So what does all this mean? Well, hardening of the arteries or vascular disease is an infectious disease, and again, is not a disease of too much cholesterol. So since it's an infectious disease, is there any answer to this problem? Well, the answer is yes. RX has introduced a nutritional supplement in China that is exclusive to RX. RX has decided to initially launch this amazing nutritional supplement only in China. This nutritional supplement is called Vanesco and is truly a vascular breakthrough. In fact, in all my years of specializing in nutritional and preventive medicine, I have never seen a product more amazing than Vanesco. Vanesco has been shown in clinical trials to have the ability to actually unroof this calcium shell in our arteries, which is surrounding these nanobacteria, and not only exposing them, but also destroying them. Vanesco is a nutritional supplement that contains a proprietary blend of antioxidants, amino acids, vitamins, herbs, and minerals. Once the nanobacteria are released from its protective calcium shell, this proprietary blend of nutraceuticals, along with our own immune system, finally has the ability to destroy the nanobacteria. Over time, this infection significantly is slowed down and even improved. The calcium deposits are also improved so that your arteries become more flexible and pliable. Therefore, your circulation is improved from head to toe. Not only are you getting more blood and oxygen to your heart and brain, but also to every organ in your body. You are literally able to restore your vascular health. Nothing is more important to your health and the aging process itself than having a healthy vascular system. Since this entire process begins early in childhood, the sooner you begin taking Vanesco, the easier it is to protect and restore your vascular health. So how do you take Vanesco? RX recommends that you take 1 capsule for every 9 kilograms or 20 pounds of weight at bedtime with a full glass of water and preferably on an empty stomach. Nothing to eat for 1 to 2 hours prior to taking your Vanesco. Scientific researchers have shown that if you take Vanesco in this manner, your Vanesco works for up to 12 hours. You should continue to take all your medications and nutritional supplements that you're already taking. The only restriction is that you should take all of your mineral supplements, just the mineral supplements, before 3 p.m. This allows your body to absorb all your minerals and deposit them in the cells and or bone where it is needed. Vanesco has the ability to bind with minerals, and we want it working on the calcium surrounding the nanobacteria. Now you can continue to take your Omega Q, Venale, BioPro Q, MOA, Rejuvenix, Slenderize, and any other supplements anytime you wish. However, it is best to take all of your Optimal M and Magnical D, the minerals, before 3 p.m. So who should be taking Vanesco? I believe all adults, men and women, should take Vanesco. If you are in your 20s or 30s, I would recommend taking Vanesco for 6 months and then going to the maintenance dose. Now, if anyone in their 20s or 30s has a significant risk for heart disease, like high blood pressure, smoking, high cholesterol, diabetes, obesity, or a strong family history of heart disease, I advise them to take Vanesco for 1 year and then go to the maintenance dose. Maintenance dosing is just 1 capsule at bedtime if you weigh less than 72 kilograms or 160 pounds, or 2 capsules at bedtime if you weigh more than 72 kilograms. For my patients who are over 40 years of age, I recommend that they take Vanesco for 1 full year and then go to the maintenance level. However, if you know that you already have heart disease or hardening of the arteries, I recommend considering taking Vanesco for even 2 to 3 years before going on the maintenance dose. Vanesco can help patients who already have heart disease, may have had heart bypass surgery, had stents placed in their arteries. In fact, these individuals may possibly have the best benefit from taking Vanesco. Remember that physicians diagnose heart disease at the very last stages. Heart disease or hardening of the arteries is basically silent. In fact, the first sign of heart disease over 50% of the time is either sudden death or a heart attack. You do not get a warning, nor do most patients get a second chance. Therefore, since nearly 50% of both women and men in China will eventually die from hardening of the arteries or vascular disease, taking Vanesco gives you the best opportunity to slow down the progression of your disease as you are able to restore your vascular health. This allows you the opportunity to increase your vascular supply to every organ in your body from head to toe. You may note more energy, more focus, clearer thinking, and even an overall sense of well-being. Men may potentially note significant improvement in any erectile dysfunction. My patients have also noted healthier cholesterol levels, healthier blood pressure levels, and healthier blood sugar levels. Now, my book, What Your Doctor Doesn't Know About Heart Attacks and Strokes May Be Killing You, has now been released in Chinese. It is being exclusively sold by RX. I present all the current and scientific medical research that supports everything that I have been sharing with you today. I have documented and detailed all of my research in this book. I would recommend that everyone get a copy of this book and read it, and then share it with your family, friends, and loved ones. Vanesco is exclusive to RX. No other company has it. It has been available now for over 1 year in China. It is a unique proprietary blend of nutritional supplements, and clinical studies have shown it to be effective. I personally feel that Vanesco is the absolute best nutraceutical product ever developed. Vanesco has the potential to significantly change the health of the Chinese people. Therefore, you have a wonderful opportunity to spread this message of health and to personally begin taking Vanesco yourself. Remember, heart disease and vascular disease is silent. You don't know you have it. It takes decades to develop significant problems, which gives you adequate time to actually intervene in this process by taking Vanesco. You don't even know you have any vascular disease until it's too late, and you have a heart attack or a stroke or die suddenly. Don't delay. Start taking Vanesco yourself today. Get your family members and loved ones on Vanesco next. Then start building your business by getting more and more customers on Vanesco as you recruit like-minded individuals who want to join you in sharing this message of health and wellness.